It's Valentine's Day, so let's get to the heart of the matter, literally heart health. ABC 7's Kate Flexter is here to explain. Kate?
Well, Alan, the term heart disease covers a wide array of illnesses, but it's the #1 cause of death in the United States. Now, medical professionals are looking to change those statistics, and they say it starts with awareness.
For years, Charlie Ann Cypriot was the picture of health. She even ran half marathons, and it was that love of running that offered her the first warning signs.
And I remember this one night, I was running and we ran 3 miles and I felt like I had been hit by a car.
For months, her illness went undiagnosed until it was finally identified as heart disease.
2 days later, I received the phone call telling me I needed open heart surgery.
Less than a year after that surgery, she's well down the path to recovery and now follows a low-fat, plant-based diet and regularly practices yoga and meditation, a program known as the Ornish diet.
I feel better now than I have ever felt. I feel healthier now than I've ever felt.
Registered dietitian Gudrun Novak says heart disease can be prevented, and in some cases the effects can be reversed by simply making the right dietary choices.
Eating more whole grain foods and unprocessed foods, and also limiting added sugars.
But she says it's not just about eating the right foods, it's also about eating the right amount.
For example, olives and olive oil and nuts and avocados are heart healthy foods, but if we eat them in large amounts, that's not good either.
The Centers for Disease Control reports 610,000 people die of heart disease each year. That's 1 in every 4 deaths, making it the leading cause of death for both men and women in America. Chief of Cardiovascular Surgery at Sarasota Memorial Hospital, Dr. Jeffrey Sell, says there are several potential contributing factors to a diagnosis.
It's related to genetics, it's related to environmental things, it's related to diabetes, it's related to high blood pressure. There are a lot of factors that contribute.
And says it's a disease that doesn't discriminate based on gender.
And it used to be thought of as a disease only of men. However, it's one of the areas where women are breaking the glass ceiling and catching up to us.
The greatest thing you can do, says Sell, is to stay in tune with your body and take preventative measures before experiencing signs and symptoms.
So it's very important to know that there are things that can cause this, there are things you can do to prevent it, and it's important to try and figure out whether you have it before you start getting the symptoms, especially if you're at particularly high risk.
For Cypriot, it's about raising awareness and identifying the problem before it's too late.
Women are uneducated about the perils and risks of heart disease. I now know. And looking back, had I known that way back when, I would have immediately said, you know, there's something not right here. We need to look at this.
Sarasota Memorial Hospital will be holding a free lecture series on heart health starting next week.
Kate, thank you.